Hi everyone, my name is Lauren Tinglin and I'm a senior engineering major with a minor in chemistry and a concentration in civic engagement and social change at Smith College. I know that was a mouthful. For the past couple of months, I've been researching the effect of the adherence to medical appointments due to the coronavirus. I was fortunate enough to receive a research grant from the NIH, and through this, I've been working with Dr. Tessa Cook at the Perelman School of Medicine at the University of Pennsylvania. For our research, we conducted a study which surveyed over 1,000 participants on their concern or hesitance, or if they're hesitant or not to go to a medical visit due to their fear of contracting the virus. However, our study is still underway. We just got our results back, so we're not ready to present anything as of yet. So this talk is going to focus on a literature review on similar studies that gave us great information and can be very useful and very helpful when we made our predictions. So I'm just going to share my screen. Yeah, so as I said before, we were studying the effect of the coronavirus on the adherence to medical appointments. And just to give some background on the coronavirus, I know we all have heard about it. Corona is like the new household term. It's kind of scary for sure, but just so we have an understanding, just like the basics. The COVID-19 pandemic is responsible for over 1 million deaths and over 200,000 deaths in America alone. So this is a very lethal virus, and it definitely has impacted a lot of people globally. And there's two main ways to contract the virus. So it's either you breathe in infected droplets from the air, or you're touching your mouth, nose, or eyes after coming into contact with the surface that has coronavirus on it. And we know, of course, we've heard about social distancing and wearing our mask, and those are the two best ways to prevent contracting the virus. But social distancing is hard if you're in a medical setting, specifically a doctor's office or emergency room, which are enclosed spaces. And regardless of how many times you wipe surfaces down, you are still breathing in somewhat of reusable air. So we wanted to see if this is affecting the way in which people are interacting with the healthcare system and whether or not they're going to their medical appointments. So I looked at two different studies. The first was a study with Harvard, the University of Michigan, and a company called Phreesia. And Phreesia is a really interesting company. It's actually a company that serves for patient intake. So it's a way in which clinicians track their patients and like in terms of pre-existing conditions, healthcare records, and specifically it was used to look at the scheduled visits, the check-in information, and the health records to see if, one, how many people are scheduling visits, two, how many people are actually getting checked in. So, you know, when you go to the doctor's office and they check you in, to see if that's aligning, because sometimes visits are scheduled, but people, of course, are not going because they are afraid of contracting the virus. And just the general health records to see like what types of things people are going for. And this data was taken from February 1st through October 10th. So very recent, which is amazing, and even up until like a week and a half ago. And this is still continuing to add more data to the software so that people can look at it and it's accessible to many different people. And the survey reflects 1,600 provider organizations, and that represents over 50,000 providers across all 50 states. So this is a huge study, a great study, and I think it's very good in terms of seeing how the coronavirus has affected the adherence to medical appointments. The second study I looked at was the Morning Consult on behalf of the American College of Emergency Physicians, and this study was similar to the study that I'm doing with Dr. Cook. Basically, researchers conducted a survey on 2,200 adult participants from April 18th to April 20th. So it started a little later, and ended a little earlier than the first study, but still great data, very useful in terms of gathering information. And similarly, similar to our study, researchers were looking at the concern of contracting the virus, and they asked a series of questions to see what people's responses were. And so the Harvard University Phreesia study, which came as no surprise, the results were pretty aligned with what I was thinking, and that people would be afraid to go to the doctor's office, of course, though they don't want to contract corona. And they found that specifically, there was a huge drop. As you can see, there is a trend in this graph. And the largest was about 60%, 60 to 70% of people not going to their doctor's appointments. So it's testing the baseline in terms of what did it used to be like in terms of scheduled visits and checking information pre-pandemic, and what is it like now post-pandemic, or not post, but continuing in the pandemic. And they found that, of course, there was a lot of drops. So people are or were reluctant to go to the doctor's office. And they also found that there is now starting to creep up a little bit. So people are becoming more comfortable, and I found that specifically around April. So around that time, more and more people started to return to go to doctor's office. Perhaps they felt more comfortable, but that's what they're calling the rebound. So people are coming back, and we're starting to see this shift back up after we had a huge decline. And then the biggest results from the morning consult, as you can see, pretty much the very concerned category, which is the darkest red, is pretty much unanimous throughout all the different questions. So people are concerned about contracting COVID-19, specifically in waiting in the emergency room or waiting in any type of healthcare facility. Some are feared about being turned away from the hospital, or the care that they're going to receive with the doctors. Sometimes just getting access to their primary care doctors is difficult, and prescriptions from the pharmacy, because of course everyone's trying to find the best way to mitigate the potential spread by having too many people in one space at once. So it's definitely more difficult to receive, or now it's a little better, but before it was definitely in the height of the pandemic, more difficult to receive care, and a lot of people were scared to go to contract the virus. So the biggest conclusions, of course, the COVID-19 pandemic significantly decreased outpatient care in terms of the visits and that people wanted to go. Like I said before, is around 60 to 70% decline in outpatient visits. Of course, many physicians, I know probably I've seen this too, but the option for telemedicine, or they postponed elective procedures. Which is nice in terms of you don't have to go to doctor's office. This can, of course, mitigate your risk of contracting the virus, because you can just log on and show your doctor whatever it is, explain your symptoms, and they can help you from home. And like I said before, there was this rebound. So they're seeing now that around April, people are starting to be more comfortable returning back to the doctor's office. And they're saying that numbers are starting to increase and return back to the pre-pandemic volumes, just basically what the amount of people, the normal, typical volumes before the coronavirus was so widely spread and was so lethal. And in terms of the second study, one interesting thing that they found was that people really believe the federal government should be making personal protective equipment more accessible, specifically for emergency clinicians. I know there was a time when doctors and clinicians didn't have enough masks. And of course, we need to protect our healthcare providers. They are the backbone of our society. And a lot of people believe that the federal government wasn't doing enough to ensure that they are being safe and protected via the PPE equipment that they need. Also, an overwhelming majority of adults, around 4 in 5, of course, are worried about contracting the COVID-19 virus, specifically in the emergency room. So beyond just the doctor's office, also going to the emergency room for things that are more urgent. People were afraid just to even go there because they don't want to contract coronavirus. And lastly, about a third of the participants postponed or avoided seeking healthcare due to the virus, which came as no surprise, similar to the results of the Harvard study. And people, of course, were worried and didn't want to contract the virus, so they opted to just not go, or perhaps just to go a little later on when the virus is a little more under control. It just felt safer to go outside. So the next steps for my study, we definitely, of course, want to finish the data and analyses and see if we have similar results as to the two studies presented here. And if not, where our differences lie, and perhaps an explanation for why they're different. Is it just different regions? Is it different demographics of the participants? So I've definitely analyzed that data fully and completely and formed some really interesting conclusions. And ideally, these results would also be published in a scientific paper, just like the results that I presented here, so that other people can have access to it. And this information can be widely adopted and widespread. And of course, we can just enhance the knowledge in the scientific community, and of course, just better the public health for everyone around. So thank you for listening. Yeah.